Hi, I'm Sue Telecat from the Bloomberg American Health Initiative. Are you and your organization working to reduce overdoses, end violence, improve food systems, protect the environment, or support adolescents in the United States? If so, you may be eligible for a full scholarship to earn an MPH or DRPH degree at the Johns Hopkins Bloomberg School of Public Health. The Bloomberg Fellowship through the Bloomberg American Health Initiative can help you transform your career, support your organization, and make a significant impact on your community. Find out more at americanhealth.jhu.edu/fellowship.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
How are you doing? It's a simple question, a greeting, an interaction between people. With strangers, it's usually just a pleasant exchange, an acknowledgement of existence in the checkout line at the corner store, or a head nod when sharing a bus seat. But what about when it's something more? A beginning, an inroad? How are you doing? When asked by someone who genuinely cares about your well-being, someone who wants to know if there's anything causing you stress or pain, someone who could potentially help connect you with resources to solve whatever problems may be causing you distress. That could be a life-changing question. Now think of a public park in a city. There are winding walkways lined with lampposts and wide expanses of grassy lawn. Enormous trees offer islands of shade and a gentle breeze. Joggers jog by and parents push strollers. People lay on blankets in the grass. Public parks have long been spots of respite in urban environments, built to protect natural landscapes and offer city dwellers a place to be outdoors in nature, away from concrete and honking cars. A sort of backyard for everyone. It's in this setting, in Prospect Park, Brooklyn to be specific, that local community health workers are walking up to strangers and asking them, "How are you doing?" A beginning, an inroad to conversations between community members, between those who might need help with something and those who might be able to connect them with that help. I'm Lindsay Smith Rogers, and this is a special episode of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. Open Air Connections is a pilot project between Prospect Park Alliance, various community organizations, and the New York City Department of Health. Born from the COVID-19 pandemic and built with basic public health principles like equity, access, and dignity, the program connects Brooklynites with much-needed services like mental health care, housing, and food access, all through casual conversations in Brooklyn's largest public park.
We sit in central Brooklyn, so we're surrounded by a number of various neighborhoods.
This is Morgan Monaco, the president and park administrator of the Prospect Park Alliance.
The park was originally designed by architects Calvert Vaux and Frederick Law Olmsted at the turn of the late 19th century. The park was designed to be respite from what was becoming rapid development across Brooklyn. Great industrialization. The park was seen as a destination for people to find respite from the busyness of city life and really get lost in nature.
Today, Monaco says, the park welcomes more than 10 million visitors a year, many of them from the surrounding neighborhoods. It's where people walk their dogs, run, ride bikes, but it's also an impressive nature reserve.
We are home to 350 acres of natural areas. We've got 30,000 trees, and we're really Brooklyn's only remaining forest.
It's also, she says, Brooklyn's backyard.
The place where people who don't have summer homes or places to go outside the city, this is where their summer happens. This is where barbecues happen. This is where people take walks and fall in love. This is where babies take their first steps or their first bike ride. Anything that's happening in life happens in Prospect Park.
Monaco has been with the Alliance since January of 2023. Before that, she worked with a youth and community development nonprofit in Red Hook, a neighborhood in Western Brooklyn right on the upper New York Bay. During the COVID pandemic, Monaco saw just how devastating the public health crisis was for the neighborhood.
I saw firsthand a very vulnerable community that was greatly impacted by the lack of a quality healthcare delivery system. That meant that there were higher rates of death as a result of the pandemic and lower vaccination rates because people don't have trust or faith in the medical industry.
When Monaco started with the Alliance, she was thinking about those troubling impacts and wondering how a beautiful public park, a space available as a respite to all, could help facilitate some healing.
I was very focused on the ways in which the park could really be a venue for offering health and wellness services beyond the ways in which we already do. We also have free fitness classes, yoga, meditation, or even just sitting on a park bench does wonders for people to just take a breather, lower blood pressure, find a sense of peace. But what would it look like if we partnered with some of the incredible social service providers, many of whom are steps away from the park? We've got one of the city's best hospitals just down the street. We have incredible nonprofits, community services. And just by virtue of inviting, by saying, hey, we're open to partnership and we've got space, right?
And Prospect Park doesn't just have space. It also has 10 million visitors a year, many of whom are neighbors from the surrounding communities.
People are coming to us. The place is a refuge, a place of where folks can associate wellness, but they're not getting their annual mammogram, or they're not getting their blood pressure screened, or they're not having a consultation about diabetes. And so how could we, by virtue of partnering, help be that bridge to get people connected to care that they need?
In the fall of 2023, the Alliance hosted a roundtable that invited a diverse group of clinicians, academics, service providers, and community members.
And we asked them, what are the big health issues that you're seeing in your community or from your vantage point in Brooklyn?
Monaco said the feedback about the major health problems impacting community members fell into three major themes.
First, food insecurity. The pandemic, completely illustrated the ways in which people do not have access to food. And that's continued to be the case since 2020. The lines for food pantries have gotten longer and longer. They have not actually dissipated. Second, mental health. In general, mental health, behavioral health, people's ability to manage stress and cope with a number of things. I mean, just the pandemic alone, still a lot of unmet behavioral health needs and dealing with the trauma and anxiety that brought. And the third is just chronic health issues for communities like Red Hook, where people don't have a doctor they've grown up with and who they trust and feel comfortable going in for preventative care. People are relying on emergency rooms to deal with things that could have been prevented if they had a quality healthcare delivery system.
With these three major needs articulated, the Alliance and the New York City Department of Health set out to find services in Brooklyn that could help address them. They worked with community organizations who had inroads with clinicians and health systems, who could refer people to resources like mental health care providers. And these community organizations had access to other services too, ones that could help alleviate other kinds of stressors that contribute to mental health.
We still have a housing affordability crisis across the city. So we hear that a lot, that is a cause of stress and that can contribute in some ways to depression or anxiety. It's all about these essential building blocks that help allow someone to feel stable. And without one of them, or without all of them being in place, it can lead to an overall sense of overwhelm or anxiety.
What Monaco is referring to here is part of a broader construct called social determinants of health. These are all of the non-medical factors that can contribute to someone's overall physical and mental health and well-being.
Mental health is so much a product of your community, your social circumstances, your economic circumstances.
That's Ashwin Vasan, New York City's health commissioner.
Sometimes mental health means addressing a non-mental health need. Most people don't want to necessarily come in and say, I have depression, anxiety, or I'm feeling this way or that way. They want to talk about what's impeding their well-being in their life. And often it's social, economic, cultural, racial in its dimensions. And we have to center that.
Vasan, whose agency has prioritized mental health on its public health agenda, says that's exactly what Open Air Connections was created to do.
Open Air Connections is very much a reflection of that understanding that bringing mental health services to places where people are already present, where they are already engaged in activities that are promoting their well-being, being in a park, and bringing it outside of the formal clinical setting and embedding it into the community. That's the foundational piece here. We're very proud of the partnership with Prospect Park Alliance and of course, New York City Parks Department to launch this and to say, how can we take a place, a natural environment like our parks, which are critical social infrastructure, and how do we incorporate these conversations around mental health and wellness and well-being, and then use that as the front door to something bigger.
Jared Grant works for NHS Brooklyn, a nonprofit that creates and preserves affordable housing and connects community members with services like financial assistance and homeowner education. They do community outreach, and since March 2024, they've been community health workers with Open Air Connections. They're the people in the park with the clipboards, the ones asking the most important question, how are you doing?
We go out and interact with the people of the community and find out the problems that they're dealing with on their day-to-day lives. We usually like to look for people that are not preoccupied. They look like they have some free time. And then we go and tell them a little bit what we're about, where we're from. I would tell them I'm Jared. I'm a community outreach worker from NHS Brooklyn. We're here in the park serving people, just trying to find out how they're doing post-pandemic, what problems they're dealing with, and how we can help.
And so, Jared, can you tell us a little bit about some of the problems that you've seen?
A big problem that we're encountering right now is homelessness. A person that we just talked to the other day was dealing with the horrid conditions in the shelters. And basically, it was an urgent matter that we had to get her somewhere safe, that she felt that she can lay her head and feel at peace for the required 8 hours that you need to get your healthy amount of sleep. We have contacts to shelters, 24/7 hotline, as well as a website. And also our counselors here at NHS Brooklyn, they deal with housing and have various contacts that would help them, will help the person that we're dealing with in terms of the housing that they need.
And were you able to get this person somewhere safe for the night?
Yes, we were. We actually see her all the time when we're doing outreach. And she says, thank you so much for helping her. You know, she was in a really big crisis.
Grant and his colleague, Jonathan Timal, are out in Prospect Park all the time, rain or shine, asking people how they're doing. Timal says sometimes people just want to talk.
We try to put ourselves out there as much as we can. We try not to intrude on some people what they're doing, but if we feel like there's time that could be made between us and whoever we come across, we always ask politely if they have some time. That could be 2 minutes to, as we go for sometimes an hour or so. It always depends on the interaction that we have.
He says people are generally pretty open to having these interactions.
They're receptive to it. They're very open on what we're doing specifically because, you know, you could just see anyone out in the public providing these resources and so on and so forth, but you never have conversations like ourselves, like actually sitting and taking our time to figure out how are you doing, the mental portion, the emotional. And this is like a big time with the post-pandemic and everything. Not everybody is open to saying certain things unless you have like a sit down. And then sometimes that's where they have the opportunity to say something to a person they don't even know.
And people aren't just receptive because they need help or someone to talk to. Grant says they also care about their community.
The people that we encounter like to know that somebody's out here trying to make the overall quality of life in Brooklyn somewhat better.
It's important to point out that both Grant and Timal live in Brooklyn, and the organization they work for, NHS Brooklyn, is well known and trusted within the community. Health Commissioner Ashwin Vasan says that's part of why the program has been so successful.
This is not a traditional government program in the sense that you will see people with flak jackets and hoodies on that say the Department of Health. The folks on the ground doing the work, engaging in those conversations are trained peers and trained counselors that are really, at the end of the day, members of the community themselves.
This trust and respect is still a pivotal part of the program's success because these are still very difficult conversations to have.
I think there's this perception amongst policymakers and practitioners in mental health that there is massive demand for mental health services and we're not able to meet that. And that's true. I think we still forget that there's an awful lot of stigma and that asking for help is still a challenge for many, many communities, especially, and this is something I feel and know personally from my family's experience, especially immigrant communities, especially communities of color. The act of asking for help is still culturally, socially, linguistically, ethnically, sometimes not accepted.
Since Open Air Connections started in March of 2024, the New York City Health Department has been collecting data to evaluate the program. Here's Vasan again.
Thus far, we have provided about 523 referrals. So that's really impressive. 96% of our participants are saying that their interactions are either helpful or extremely helpful. 60% of park goers are actually getting a direct referral to neighborhood health services.
Vasan says that the majority of referrals are for talk therapy and counseling. 30% are for housing support, such as help with rent applications and landlord or tenant issues, and 22% are for healthcare or primary care providers. A surprising number of referrals have been for peer and work support,
particularly for people with disabilities. So that's really interesting and important. About 37% of our referrals are for people with disabilities who are struggling to navigate systems.
But Vasan says that it's not just connecting people with the resources they need, but in making sure the care they get is actually helping them. That's something they want to be able to measure going forward.
What happens to those folks? Are they getting into care? Are they getting their needs met? Ultimately, we want to create a front door into care, but we want that care to lead to something meaningful for the person.
Morgan Monaco says that this kind of follow-up will be key to understanding whether and how the program continues. They'll continue to collect data and feedback and then hopefully be able to generate more funding to keep the program going.
Success looks like, a healthier Brooklyn, right? Where people are having the opportunity to realize some unmet needs and get those connections to care back in the community.
Open Air Connections is pulling from a playbook of tried and true public health approaches to healthcare. Training peers to connect individuals with needed services, being physically out in the community and literally meeting people where they are, and thinking through the many things that can impact our physical and mental well-being. These are all basic tenets of public health problem solving. But perhaps the variable that's unique here is the park itself.
Open Air Connections is a very specific program designed to help address some health disparities. But in general, it's in the larger context of the role that parks play in bringing people together and fostering better understanding and a better civic society. One of the most kind of important parts of this program is that parks and open spaces are the great equalizer. It's where people from all walks of life should come and feel welcome and be themselves.
It's also a pretty beautiful space to work in, as Grant points out. What's your favorite place to talk to people?
I would say Lookout Hill, because you get to see the whole of the park. The weather that's taking place that day also accents the view that you get. If it's raining, you get kind of like a gray backdrop on the water. If it's sunny, you get that nice shine on the water. I really enjoy the experience, and it's really peaceful in my opinion, honestly. Definitely de-stresses you.
Currently, the program is limited to Prospect Park, and Ashwin Vasan said that's partially by design. Because services are so localized, he says that most people who are referred for care can get an appointment within a week or two at most. Care providers are also geographically nearby.
We've said, how can you get what you need in your community?
Morgan Monaco hopes that eventually they'll be able to replicate the program in other city parks, even in other cities across the country.
I'm really excited about the potential of where these partnerships and pilots like what we've launched this year could lead to in terms of being one intervention among many to really improve the health system in our country. I think the pandemic really exposed the ways in which there are such deep disparities in who has access to care and who doesn't. And I'm hoping that, in some small way, we're playing our part in that larger discourse around how do we keep people healthy.
And as Timal says, this is work they hope will have a lasting impact.
We're trying to make a difference, not just for a few months, but prolonged, right? We're going for years, not just temporary solutions.
Thank you for listening to this special episode of Public Health on Call. To learn more about Open Air Connections, check out the resources in the show notes. If you have questions or ideas for future shows, email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.